Hi, everybody. I'm Dr. Anita Kumari. I have Dr. Neetu Nivani and Dr. Nidhi Gupta with us, and we will start this session. I know there are a few people today. They will join. Let's start. I think I don't. You guys should put the questions in the chat box, or you can raise the hand if you want to talk. I will start with few of my own questions, Nidhi and Neetu, if you guys can tell me. So one question I have is right now, because we are doing self quarantine a lot more, what is the simplest way to do self quarantine? If you can come up with, like, something, if a family of three, four, and they have to quarantine one of the persons, what is the easiest way to simplified version for a family?
It's just the best way to, I know it's hard, and people have different living situations, smaller room, bigger house, I don't know.
Mhm.
But the simplest way to think about it is to assume that the person who's being quarantined just, has a disease and you are protecting the rest of the family. So if you start with that thought process, your quarantine would be more effective.
Okay.
And with that thought process in mind, so ideally the person you're quarantining should have his or her own room, and the door should be closed, that door inside the house. It's okay for them to open the window to let in fresh air,
Okay.
but the door should be closed ideally at all times. They should have their own separate bathroom. They should not share any personal items, including towels, and any of those things. Only one person in the household, an adult healthy person, should be tending to the needs of the person in quarantine. um, Now, if the person is not COVID positive, if it's just presumptive,
Uh-huh.
then the recommendation is you may not wear the mask. But if the person is COVID positive, then both the people, the person who's taking care and the person who is in quarantine, should be wearing masks.
Okay.
And in terms of um, tending to the needs, the person who's tending needs should ideally be wearing gloves when they're handling the utensils, the clothes, and everything else. The laundry can be done together, but it should be in hot water. The
Okay.
utensils, preferably disposable if possible. If not, can be washed in hot water or dishwasher. That's okay. The person who's in quarantine should not share any food with the family or even the pets.
Okay.
So those are just the basic things to.
And for how many days? I remember we had this discussion as to how many days if they are symptomatic, but there's no testing done, or if the testing is negative, but we are,
Mhm.
thinking probably it was false negative. So what would be the?
So
It's Yeah, sure.
can I add something here,
Yes.
because there's
Yeah,
a lot of confusion out there about what is quarantine and what is self isolation. I just want to
correct.
kind of give a little bit of a clear idea. So quarantine is basically your trying to avoid the spread of the movement of the virus. Basically, you're avoiding movement of an individual who you think might have contracted the virus if they were in an area which had an outbreak, right? So quarantine does not mean that the person has symptoms. We're just quarantining that person for 14 days to
Okay.
notice if they have, if the symptom development happens, so if they, if they are developing symptom or not. And the reason for quarantining is obviously to avoid spreading of the virus, versus self isolation, which Dr. Nidhi was just describing, is when somebody has any sort of a symptom, be it fever, cough, shortness of breath, or any other upper respiratory symptoms. Right now, we're assuming anybody who has any sort of symptoms, we're assuming they have COVID
Mhm.
until proven otherwise.
Mhm.
And you assume that the person has COVID, you start doing the self isolation. So there's a difference between that. And self isolation means that the person is going to be isolated from the family or isolated from outside world if they live alone. And there's certain guidelines or criteria they have to meet to take themselves off of self isolation. if you guys want, I can talk about that. If you want, I can talk about it later, whatever you guys want.
Self-isolation, is there a concept like self-isolation for individual versus the whole family from the rest of the world, or and for how many days? I remember you had discussed that, so please need to go ahead and tell us that. That's a very important information.
So self-isolation is for people who have symptoms. People have symptoms, you want to isolate them from the rest of the population so that they recover from the virus without spreading the virus to other people. When you are in self-isolation, there's three criteria you have to meet to come off of self-isolation. One, you should not have any fever for 3 days without using any fever reducing agent. So 3 days of no fever without using Tylenol, acetaminophen, ibuprofen, anything that the person is using. Two, and that's not or, it's and all their symptoms like cough, shortness of breath has resolved. And it has been at least 7 days since their first symptom appeared. So those are the three criteria they have to meet before the self-isolation is taken off. So what is recommended is, person who is, so it's a family, right? And one person has contracted COVID, they're going to be in self-isolation. At the same time, what we're recommending is, because the family is still in close contact with that individual before they develop the symptoms, and we know asymptomatic transmission is happening before even the patient develops symptoms, we advise even the family to kind of restrict a lot of movement outside, go outside only if absolutely necessary, like getting medications, or absolutely necessary if they need to have groceries. So basically quarantining the family as well for at least 14 days.
Thank you so
And
much.
correct me if I'm wrong, Nidhi, I mean, that's what we are doing, but
Right, absolutely, yeah. 7 days.
Hi, Smriti.
Hi.
Hi, how are you? So I'm going to take the few questions that I see here. This is from Mukesh. Is this airborne? Can it stay in air? If yes, how long?
Yes. Thank you, doctor, for taking the question.
Sure, Mukesh. Thank you.
Sure. I can reflect on that. I mean, there's lots of reports that are coming out discussing this situation about airborne. And airborne typically means that the virus can survive in air for several hours without needing a vector like a droplet. So the thought initially was that this is droplets which settle down on surface, and we touch the surface, and then we kind of touch our face and passages, and so airborne, when you are now, what we are seeing, the newer reports that are coming out is it's suspended in the air, sort of aerosolized for a few hours, up to 3 hours. It can be. And the half-life of the virus in the suspended air is about 66 minutes. That was the New England Journal of Medicine study. So after an hour, in the vicinity of the infected person, you can expect the virus to, if depending on the concentration that was released in the air, the quantity is reduced by 50%, and another hour by another 25%. And by end of 3 hours, you can suspect it to be 12.5%. So long and short of it is that those are and it also depends on the air movement, the temperature, the humidity, if the person is actually coughing, sneezing versus just talking. So those are different factors that take into account into how much of the virus is suspended in the air or airborne at the time. So thinking that in mind, the CDC came up with the initial recommendations of the isolation with 6 feet, covering your mouth, not touching your face. What we're hearing, today is just an extension of it. If you can imagine, if there's greater number of people walking around infected, asymptomatic, there are several studies that are coming out. Even if you're talking to a person, depends on how long you talk to an asymptomatic but infected person. So I hope I kind of gave you sort of an idea of airborne, but need to go ahead if there's more.
So I know there's the study that you're talking about from New England Journal of Medicine that it's up to 3 hours. And there's a lot of information out there that even while talking, as you were mentioning, like if somebody's talking loudly, the aerosolization can happen and the virus can live in those aerosols and infect the other person who they're talking to. So, I mean, I'm not sure if, at this point, the data is 3 hours. So.
And can I add or ask? I think that's what most of the public wants to know. Should they or should they not wear mask? Regular mask even.
So if you are actually coughing and have any kind of respiratory symptoms, I would, in general, I mean, this is we even tell to patients with influenza or even common cold, we've said that for several years. So you should wear a mask. The idea of wearing mask in common population is not to infect others more than thinking that I will not catch it, So you're kind of protecting the rest of the people around you if you are coughing and sneezing and you have something going on. The important thing to remember when you wear any kind of mask is you still maintain the social isolation when you're, just wearing a mask doesn't mean that you're protected. And that's a common reason why wearing a mask fails. If you're still touching your face, if you're still adjusting your mask all the time, then it's useless. Then the point of wearing a mask is lost. So there are several videos out there on proper use of mask. I wouldn't recommend going out for an N95 or a surgical mask or any of those things. But if you have a cough and you have to go out for essential items, I think it's recommended to use a mask of some sort.
That's actually a very interesting question. And I looked up all different countries depending on it, because I genuinely believe that there might be some protection with the mask, honestly.
Yeah.
And I looked up the data from different countries, and what I found that there's some countries who are actually recommending wearing a mask in general population when you go out. There are some countries who are saying, well, wear a mask if you're going to a crowded place or using a public transportation and there's no other way out of it, which hopefully we all don't have to do because we are shelter in place. And obviously we know that US is not recommending at this time. The only caveat is if you do have symptoms, then please wear a mask when you go out. If you have to go out, which you shouldn't, but if you have to, then please wear a mask. But other countries actually some countries are actually recommending wearing a mask all the time if you go out publicly, if you are in, if the country is under lockdown. And if there are some countries that are recommending only wearing a mask when they go to crowded places and using a public transportation. So just sense on it.
I'm sorry, I'll just add one more thing. So N95 mask versus regular mask. Is there any data if it is not fitted for a normal person, not a healthcare provider? Not fitted, but is there any data to support which one is better? They are same, equal, even for symptomatic people? Do we know? Should we? My understanding, and I'll say my understanding, if they are not fitted properly, even for a healthcare provider, it's of no good. It's almost like a regular clothes mask or a bandana if needed.
If it's not fitted. And we highly recommend general population not to reach for N95, because if it's not, like Anita, you're saying, if it's not fitted and if you're otherwise healthy, you're maintaining social isolation, you're really not, benefiting from using an N95. And there's so many healthcare providers in the front line still do not have adequate supply. So please do not go out and try to obtain any N95s or surgical masks. If you are sick, just a regular mask that homemade mask, that's okay. Just cover your cough the best you can. Yeah.
And I would recommend, if anybody has any of the N95 masks, please donate it to any of the physicians. We need it really, really badly, because we have so many of our physicians who are reusing their N95 masks. That is not ideal in this. We have to protect each of us. So I'm going to leave it there. I'm going to ask another question. What precautions this is from Mr. Digvijay. What precautions to follow when we have to use apartment public shared laundry? Is it safe to use shared washer dryer for clothes? Very good question.
I can actually, because I live in an apartment building, so I can shed some light on that. First of all, you should avoid going outside. Unfortunately, when you live in an apartment, you have, elevators that are used by 500 other people or 600 other people or how many ever. One of the things that I have been doing, and is to basically avoid taking elevators. Take stairs. I mean, that's the best way to avoid. If there is even an aerosolization in an elevator, you want to, because it is known that aerosolization can stay a little bit longer in a closed space. So avoid taking an elevator. Use if you have a disinfecting wipes, use those when you're handling the doorknobs. Just like what you do to at least exit in and entry into the building. In terms of laundry, as far as I'm aware, like if somebody's using a proper soap and using a hot water, I mean, the wire should not be present in the common laundry. And I don't use common laundry, so I'm not sure if that would be an issue. But if you guys can shed more light on it, I don't think so that should be an issue if you're using common laundry.
Nidhi, you have
Yeah, I completely agree. I think hot water soap kills the virus, so there should not be any reason to avoid laundry. But while you're going for the laundry and coming out, that's the higher risk where you will catch it, not the laundry itself. So all the touch surfaces, make sure you're maintaining hand hygiene, not touching your face when you're coming back, all those kind of things.
About cleaning hands, so please clean hands.
Clean hands, yeah,
very, very important. Nothing like that.
Don't touch your face and wash your hands.
I'll let Smriti take the question. Smriti, you want to ask your question?
Nothing. Sorry. I don't know if you guys just got the link. I just sent an URL. It says that corona can survive in certain kind of shoes and PVCs up to 5 days. And the source is they've confirmed it from the National Allergy and Asthma Associates. So they're coming up with a caution, especially for children. Don't make them put their shoes, and try to keep them inside your house, and not in a major inner surfaces and stuff like that. So there is a new warning which they're recommending. I sent a link in the
yeah, I see the link. Thanks, Prati.
And I just saw it today afternoon. Yeah. That's why I was like, ooh.
We're learning so much about the virus. Yeah, I was reading yesterday from the cruise, 17 days after the cruise ship was evacuated and the people went in to clean it, and they still found traces of virus in the ship. And I was like, okay, it really depends on the condition where the virus drops, how much is the humidity, the temperature, what kind of surface. So it's really hard to reduce your risk to zero. That's what I would say. Just hand hygiene and not touching face is your best, cleaning, like, all the guidelines are coming out, the usual stuff.
Stay home.
Yeah, stay home.
Stay home. I have another question from Mr. Darshan Sheth. If someone and whole family has not left home for 14 days and sees the symptoms like cough, does he need to follow quarantine guideline?
So I cannot comment exactly on what else is going on, but I can make a comment as a, general statement. If somebody has been staying home and is otherwise healthy, the question that comes is this, could be corona or it could not be? And the answer is yes and no to both, because the incubation period can be longer than 14 days in some people. If you have other immunocompromised system, maybe you would not strike a response for 14 days. Yeah, there's other factors that can delay the incubation. So yeah, it could be. Or it could be, there's allergy season, there's a lot of other things going on. So my advice is, if you are developing symptoms after 14 days, please reach out to your doctor, and based on the full history, there would be a proper answer for your symptoms.
And again, you haven't gone out, but maybe you got an Amazon delivery. Maybe
yep.
A delivery for food. I mean, there's a lot
other
of
things
that play a role into this, So If you've been totally like not getting anything from outside and staying home, it's less likely, like Nidhi said, but always talk
And
to
the other thing is, I think now with the testing being more prevalent and more available, if it is such a important question for them to answer, they can actually get the testing done, right? It now, what I read from the last message you sent me to, they
Yeah.
don't even need a prescription,
Yeah.
a doctor's prescription. They can directly go and they can assess on the phone if the
Right.
patient needs it or not. So that's a very good thing.
Yeah. A lot of
Nobody needs to just wait.
Yeah, and testing is becoming more and more widely available throughout Bay Area.
But there's a caveat to that, because if you're tested earlier in your sickness, the test is negative, and you still have to be careful. If you were exposed, there was a reason why you were exposed and you needed to be tested. If you were tested earlier in the course of the illness, it's negative.
Yeah, but if
You
somebody
still have to be careful.
somebody has waited for 14 days and is
I
still
see.
coughing, then it makes sense to at
Makes
least
sense to get it.
start the testing, if needed. But yeah, definitely reach out to your physician, because they would be actually knowing your history in and out, and they would actually be able to guide you. Testing is more prevalent now. It's easily available. So they should not be a reason why you would not get tested, if that is the question. Next question I have is from Madhusmita Sahu. Hello, everyone. What is meant of half-life of virus? Could you please elaborate?
Oh, I think it's because I mentioned the half-life of the virus is, it's more related to how much of the viral particles are alive. It's the replication rate. So in a certain amount of time, the concentration of the virus, the live particles, reduces by half. That's the half-life. That's what I meant.
Okay. Thank you so much, Nidhi. Next question is from Mr. Mukesh. If mask does not protect, is it only recommended if you have cold?
That's, that would be a general assumption by what I meant. Yes, if you're actively coughing and like the other things that Dr. Nibwani mentioned, if you're going in a crowded place, then wearing a mask can offer protection. Yes.
And I
So
did go ahead.
as an example, like if let's suppose you go to Costco for shopping, right? And if N95 or surgical mask does not offer protection, it's just recommended, then definitely why we should venture out, right? If it's really not protecting us.
So yeah, good question, Mukesh. So I will add here, I know Nidhi and Neetu had already talked about this, but if we see into country-wise mask versus no mask, there are certain countries who are saying everybody should wear mask. And there, my understanding is the flattening of curve is better with them compared to other countries who say, oh, mask doesn't work at all, they're not airborne, things like that. It's so early in the prediction of this virus, how it's going to help or how it's going to be worsened. I would suggest, if you guys, and it's just to protect yourself as well, protect the others from your coughing or sneezing. It's not a bad idea if you have regular mask or even a surgical mask. N95, as I said, because they are right now, they are the gems of for all the healthcare providers, and we would like, because if they're as good as just a surgical mask, there is no reason why the community should be wasting it. It can be used for something more important. So that's why I highly recommend just wearing a regular mask and donating the N95 mask to others, to the healthcare providers. But yeah, that's just if we see country to country, there is a lot of data coming out now that the countries who recommended wearing masks for everybody are doing better in the flattening of the curve. But person to person, we are still not sure unless you're symptomatic. You want to add anything, Neetu or Nidhi or Smriti?
No, I think it's the same thing with the masks over and over. If a mask is not properly used, it's not effective, and the risk of the risk of catching the infection is higher when a person is actively coughing in front of you. And for those reasons, like you mentioned, Anita, The N95 and the surgical mask are not recommended for general population. Covering your cough, not touching your face is still the best way to go.
Yeah. And if N95 mask gives us, like it's a sense of security, as well as it's a false sense of security in a way as well for those people who are not fitted properly. So that's something that everybody should remember. N95 mask, unless fitted properly, is of no use. That's so far that we have read and heard. Yeah. I'll take the next question. From Madhusmita, if heat kills coronavirus, does it mean if a person drinks hot water, he's safe? Or if a country has hot climate, the chance of corona is less? Good question. uh, Neetu, you want to take this question, or Nidhi, you want to take this question?
As far as what I have read, there was one paper that said if you do steam inhalation and if you do saltwater gargles, if you do have, some sort of sore throat or like which could be related to coronavirus or COVID, there is some data saying that there could be decrease in the virus replication, or you could say the virus load in your throat. That's my understanding, but this is such a gray area. Like nobody can say for sure if this works or not. And Nidhi, you can shed more light on it. But that's what I have read. So, there's no harm in drinking water, no side effects. So, you can drink it, but that doesn't mean that it's going to protect you. You have to do all the other things as recommended as well. So that's just, what I think.
What about the hot climate compared, like, say, India to Africa?
Time will tell, right? We're all waiting to hear that good news that climate does it. There's no reports, there's no data from the labs that we have so far saying that a certain temperature is going to just wipe out this pandemic. I hope it does. I really, really do. Not that the California weather is warming up enough. It still dips and ups.
More data from India before that, because India will probably get warmer before us.
I really hope we get that good news from there. But regarding the hot water, once the virus has infected one of the cells inside your lungs and the process has started, drinking additional hot water is not going to kill that virus. It has triggered a reaction inside your body. So again, yes, drinking hot water is not contraindicated. Make sure it's not burning hot. You don't want to burn your passages, but it's not going to kill the virus.
So I'm going to just add one more question here. So I'm also hearing and seeing a lot of discussions about the genetics of Indians or certain other countries, which are considered to be protective for COVID. Like, say, G6PD protects against, sickle cell. G6PD sometimes protects against malaria. Right? Yeah. So in the same way, is there something like that that we see for COVID, or there are any genetic mutations, or are Indians protected?
I've not read about genetics, but I want to add this. I read an article on BCG vaccination. And because all Indians probably got that as when we were kids, and I think there is some protection there. That's what they're saying. But it's so up in the air right now. I don't know. But that's one article that I read on that.
And actually, there was a very good discussion with the infectious disease doctor. And I remember Dr. Meenu Vaid actually mentioning that even if the BCG probably could have helped, there are new trials coming up, but the effect lasts not more than 15 to 20 years. Exactly. Most of us are beyond that. So I'm still trying to learn.
We're waiting for more to hear data. There's nothing out yet, but let's hope we find something.
I've read something on the
interesting
blood group. I don't know if you guys have read anything on those lines, but there's so
the
much
BCG,
blood groups.
The blood group, that's also that's another thing.
The type of blood group can predict if you're going to get severe infection or not. Like O positives are like a little bit more immune to the infection. I mean, I don't know the data. I've not looked at the articles myself. I've just read about it. But yeah.
It's all retrospective. It's all like, we are just assume there are a lot of speculation, but unless we have real studies and real big data, population data, we will not be able to say. But I think the whole of India is going in one direction, and that really gives us a big country. Okay, they are using the hydroxychloroquine and the Zithro, hoping it all turns out okay. And also, the 21 days social distancing, they are doing really, I would say, better or good overall, I would say, but we'll see. Next is this is from Ritwik, with given impacted people population count, can we go for walking, running outside of a community area with 6 feet distance from others? Do we have any data to see the impacted population count by postal code instead of county?
Do you have one, Neetu?
No, well, you mean the different counties?
By postal codes.
Postal code. Ooh, no.
That would start riots, I would believe.
No, I would say
I mean,
release.
there's so many websites coming up, but that would lead to so much mismanagement of the pandemic, because people in the lower postal code, postal codes where there's less infection, people might feel safer and not follow shelter in place, which defeats the purpose of shelter in place in a pandemic. So I hope they don't kind of release that information.
Also, there will be more influx of people from the more dreaded counties or zip codes and
all sorts of things.
Yeah, I think and it's the same concept that I think just having one state being in shelter, it does not help, because there's always outflux. Like, people can start moving out of California, even those who are asymptomatic or carriers or just barely symptomatic, they can move out of California right now and just infect the rest of the country. I'm just
like Wuhan.
I mean, that's what's happening from New York right now, honestly.
Yeah.
We are just spreading the infection. Unless the whole country locks down, there is not much of, I just hope California can do better overall. But so can I ask one more question, and I will wind up after that. So 2 weeks we have been almost in social distancing and shelter in place, and most of the people are following. What do you guys think? Are we still really flattening the curve? Is there any other goal that public should be waiting for? Are we reducing the number of deaths? What is your take on this? Too early to say, but
in my opinion, I think it's too early to say. I don't know if we are actually flattening the curve, or there's a lack of testing, which it's going to ramp up in next few weeks, and I think in next week or two we'll know more. But I think it's too early to say from my perspective again. But.
And I agree, because we just finished our 2 weeks, right?
Yep.
We just finished our 2 weeks of shelter in place, and the next 2 weeks is going to really determine, at least in South Bay, or where we are in Bay Area. I can't speak of LA. We're hearing different things about LA, right? So keeping our fingers crossed. Too early to leave yet. Continue the shelter in place.
I would think this shelter should continue at least till May first week or second week. I'm just hoping we can continue to flatten the curve, but that would be the right time to actually know the results, right?
It's really unfortunate that we didn't do the national lockdown when it was needed. Now even if they do it now, it's going to take a long time to flatten the curve, like throughout the country.
All over the country. Yeah, I think it's going to go from state to state at a different,
take at least month, maybe more.
Yeah, there's one question. So 2 questions, and I'll take the first one. And sorry, Shilpa will have to take your question next time. So there's one message which is floating in WhatsApp: A or B plasma donation for a COVID patient. So it's the convalescent plasma that they are talking about. Is there, and just curious to know how it helps. That's a good scientific question.
So it's the same thing. Whenever you have an infection, your body's immune system makes antibodies. That's your defense against any infection, whether it's virus or bacteria. So the idea is when a person has recovered, they have this defense system active and their antibodies circulating in their blood. And if you take those antibodies and give it to a person who, for whatever reason, has not developed them to fight the infection and is having hard time fighting the infection, then that could help that person. And there's a trial in New York in Mount Sinai actively going on where they take the antibodies from recovered patient and match it with, obviously they have to be matched based on your blood type, and give it to critically ill patients. We are waiting for the result of those trials. And I think there are, the FDA has given a permission for, other hospitals in the country to use for trial of, it's called plasmapheresis and of convalescent serum. So yes, there is a role for critically ill people, people who are in the ICU, and doctors are trying that.
Thank you so much. And if anyone who knows of any person who was COVID positive, please let one of us know and we can reach out to the right people. That is, I think one of the MD Sahelis whose husband is affected as well. Let us know and we can sort out and we can help. I think I'm gonna wind up now. We thank you so much for everybody to come and ask your questions. These are really good questions, and thank you, the panelists. Neetu, thank you. Nidhi, thank you.
Thanks, Anita. Thanks, Neetu. Good to see you again.
Thanks.
Bye.
Good night.
Good night.
Bye, Smriti. Bye, Kavi.